Hello, 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 everyone. Welcome back. It's Dr. Tamara Beckford with Your Curing Docs, where we are going to let you know what's going on inside your body so you can make some great medical decisions, right? We need to know what's going on so that we can be compliant. That is, we'll take our medicines because we know why we're taking them. We can discuss things with our doctors and feel empowered, right? That's the whole point of Your Curing Docs. So, today, we are going to go over some things, right? We are going to go over, let me bring it up for you. Let's get this high blood pressure under control. We're going to talk about this is a part one. Why? Because there's so many medications out there. We're going to talk about medications and side effects, but we're going to go over three of the types of medications out there and some of the side effects that it causes, right? Why are we talking about this? Because almost half of the US population has high blood pressure. Yes, almost half. So this is a 45%. And 1/4 or 1/4 of those with high blood pressure, it's not under control. Now, I know it's not under control, not because everybody's just not taking their medication. No, some people are taking it. Some people are having side effects, and you're like, I don't even know why this is causing this. And some people have stopped taking it. Why? Because of the side effects. So it's important. And therefore, I feel like let's go over this so we can know what's going on inside our bodies. Let's try to get this under control. Now, keep in mind, most of the time, blood pressure, the first line treatment is usually lifestyle modification, right? But let's go over and talk about what is high blood pressure. It is a condition where the force of the blood against the arteries are just way too high. As a result, the pressures are high, right? So high blood pressure is diagnosed if the top number, which is your systolic number, is greater than 130, and the bottom number, which is the diastolic, is greater than 80. So once you're creeping up, you have like the type 1 or the stage 1, then you go to stage 2, then you go to stage 3, right? The higher it is, the more dangerous. And also keep in mind that high blood pressure is considered a silent killer because half the time you don't even know you have it until it starts to cause damage, right? So that's why we're going to talk about it, because we want to get this under control. As usual, we're going to start off with some stories. First story is Grandpa Eddie. So Grandpa Eddie is like, oh my God, yo, it's really nice out. I'm going to have a family barbecue. So he throws a barbecue and he's talking to one of his grandsons. So his grandson's an adult male. He's like, yeah, I've been diagnosed with high blood pressure now for the last 6 months. That's what Grandpa Eddie is saying. But he's like, I stopped taking my medicine a couple months ago because every night I keep getting up and having to urinate. I keep going to the bathroom so frequently throughout the night. He's like, I can't. I'm just waking up. I'm tired in the morning. He says, I know I'm a grandfather, but age is nothing but a number. I got things to do. I can't just be up all night and can't function during the day. So he's like, I stopped taking my medicine. The grandson says, Grandpa, I think I know what you need to do next, right? Boom. That's part one. Next is Lance. So Lance has a family history of high blood pressure. Although he's a young man, he's in his late 20s, right? Every year when he goes and gets his annual checkup, his blood pressure is noted to be higher and higher. He's done the lifestyle modifications. He exercises. He's also studying for his LSAT because Lance says, I want to go to law school. So he's studying one day, and then he notices for during that week, although he doesn't drink alcohol, he doesn't smoke, and he doesn't drink coffee or use any type of supplement, his heart starts to race. So it raced a little bit, then it stopped. But this time it's just racing continuously, and he's sweaty, and he's just like, I don't feel good. So he says, take me to the Your Caring Docs ER. So he goes over to the ER. We'll learn about that next. So now we're going to talk about Maria. So Maria is an aspiring singer. Maria says, you know what? Ever since I learned my ABCs, I've wanted to sing. This is what I want to do. She has a history of high blood pressure. She does know that. She's been taking her medications for her blood pressure, but she notices that she's getting this dry cough. And it's just like, Every time she's just getting this dry cough. And she's like, this is causing me a lot of issues because I can't hit my high notes. And what's worst of all, I have this really big, important audition coming up. So I need to get this under control, right? So we're going to talk about all three of those stories and how we help them out right here today. So first, let's go back to Grandpa Eddie. So Grandpa Eddie is talking about his medication that's causing him to urinate a lot, right? So that type of medication is in a class that's called diuretics. So what are diuretics and how does it work? So the diuretics, it helps to bring sodium out of the blood through the kidneys into your urine. Now, the thing about sodium within the body is that once sodium is on its way, water follows. So water is like in love with sodium. So if sodium is hanging out and going this way, water is following along with it. And when the water follows the sodium through the kidneys, guess where they're going? Right out there. That's right, to the toilet. You are peeing. Urinate, urinate, urinate. So that's how diuretics work. Diuretics lowers the blood pressure by gets rid of excess sodium, right? And the excess water. So things just get less volume and therefore the pressure drops. So some examples of these diuretics, you might have heard them. If you're in different countries, you might have medications that are similar sounding, right? So here in the US, you have the chlorothiazide. That's a very common one. You have the hydrochlorothiazide, which is also called HCTZ. Those are medications that are diuretics. You might also have furosemide, which is another diuretic. Spironolactone, those are diuretics in that they get rid of excess fluid, right? Excess sodium and therefore excess fluid. You usually urinate a lot, and that's how it lowers the blood pressure. There are also some side effects, right? It's getting rid of excess sodium, which is salt. So one of the side effects is that your salt level can drop, right? So your sodium levels can drop when you get your blood checked, like the blood chemistry. It can also, some of the different diuretics can also cause additional chemistry abnormalities. Like some of them can cause your potassium to also drop, right? So if you might be on like a furosemide or the hydrochlorothiazides or the chlorothiazides, you might be on a potassium tablet also to help to keep that balanced, right? So urinating a lot, that's your side effect. Why? Because that's how the medication works. And it can lower your sodium and your potassium. They have different types of medication. So not all of them lowers the potassium, but most do, right? So that's what's going on. So Grandpa Eddie, his grandson said, Grandpa, why don't you talk to your doctor? He's like, well, I don't know. He said, yeah, man, just try. So Grandpa Eddie said, all right. So he calls his doctor and he discusses his concerns. He said, listen, I'm up all night. I'm urinating all the time. And so his doctor says, well, Grandpa Eddie, I'm glad that you called me. Why don't you switch your medications from taking it in the nighttime to just taking it during the daytime? Grandpa Eddie's like, that's it? And the doc says yes. And so he switches his meds. And guess what? Grandpa Eddie is able to sleep throughout the night. And he's a happy man because he can continue doing what he wants to do. Going to the casinos, he's hanging out with his friends, and he's make sure that he has a great and happy life. And his blood pressure is under control just from that one phone call, right? And discussing his side effects with his doctors. Alrighty, so off to the other person. We're talking about Lance. Now remember, Lance is studying for his LSAT. He has a history of high blood pressure. He's been doing the lifestyle modification, and it just might not be working. But then he starts having his heart beating really fast. So Lance goes to the Your Caring Doc's ER. He goes and he gets checked up, and what do they see? They see that he has this abnormal rhythm that's called SVT, supraventricular tachycardia. It means that his heart is beating super fast. So the doc says, you know what? I know what we can do to help you. So he gets his rhythm under control, and then he starts him on a medication called beta blockers. Now, We're like, well, what's a beta blocker? So a beta blocker is a beta adrenergic blocker, right? So adrenaline, which is the hormone that's released when we're all like, or we're super excited. Like, yes, when you're super excited, your heart's not like, oh, that's nice. Yeah, I'm going to be super mellow because you're excited. No, your heart rate's like, oh, yes, yes, yes. And it's pumping really, really, really fast. So what we do is block that adrenaline beta block. So it blocks the adrenaline so that the heart, instead of it being super excited, even if it's normal rate, we bring it lower. So you lower the heart rate by blocking the adrenaline, right? And therefore the heart rate decreases, the force for which it's pushing out all this blood goes down, and therefore the pressure also goes down. So that's how beta blockers work. Think of it kind of like the yoga of medications, right? Let's get you into that normal, cool, calm state. Yes, that's how beta blockers work. So in doing so, there's some medications that are some common beta blockers. Now, you tell me if you notice a pattern. So atenolol, bisoprolol, carvedilol, metoprolol, labetalol, sotalol. Are you noticing a pattern? Yes, a lot of them sounds like alol. They end in the alol. So yes, go ahead and look at your medication. See if you have a medicine that ends in the alol. If you do, then your medication is part of the beta blocker doses or types of medication, right? So what are some of the side effects? Fatigue. Why? We are bringing everything down and making it super mellow. So therefore, if your heart rate is usually a normal heart rate, then it might get a little bit lower, right? So that's how we're able to decrease your blood pressure. Some people can also get like insomnia from this, cold hands, cold feet. So just think about all of that, but think about how it works to make sure your blood pressure goes down, right? It's like the yoga of blood pressure medications. Alrighty. So Lance, your Karen Doc ER, he's talking about it. They said, okay, we see the SVT, they treat it. So they start him on his medication, and then his heart rate, his blood pressure is down, and he takes his test, he earns a competitive score, and boom, Lance is off to law school. Go Lance. Go Lance. Yes, off to law school. Good job. All right. So next we have Maria. Now remember, Maria is an aspiring singer. She's taking her blood pressure medication, but she's having this dry cough. And she's like, I can't hit my high notes. And I have this super important audition coming up. So she says, why am I having this, right? So we go over the type of medication that Maria is on is called an ACE inhibitor medication. So those are some of her side effects from that medication, which is a dry cough. So what's an ACE inhibitor? First, what is ACE? It's just like this long word. It's called angiotensin converting enzyme. That's what ACE is. And what does that do? It is a hormone that's released throughout the body, right? And the angiotensin, it causes the vessels to constrict. When vessels constrict, pressure goes what? Up, right? So with the ACE inhibitor, you try to block that so that the vessels relax. And when the vessels relax, the pressure comes down. So that's how you do that, right? So it causes the relaxation of the vessels, especially the ones towards the kidneys. That's where the ACE inhibitor really works. And therefore the pressure comes down. Right? So some of the side effects of being an ACE inhibitor is dry cough. Some people can get a swelling called an angioedema, where you just wake up and suddenly like 1/4, like say if your lip is in 4 pieces, right? 1, 2, 3, 4. You just start getting swelling on one part, or the whole lip is swollen or the tongue is swollen, that is some type of the side effect of these medication. That means that you just stop it, right? Call your doctor, stop, go to the ER, get evaluated, right? So what are some of these blood pressure medication that are ACE inhibitors? You let me know if you recognize a pattern. So benzapril, captopril, enalapril, lisinopril. That's correct. You are noticing the pril, ACE inhibitors, right? So if you're on a medication that ends in the pril and you're noticing that my throat is always dry, and I'm just, even if I'm drinking water, I just always have this dry throat, talk to your doctor, right? Because guess what? That's what Maria did. She went and she said, listen, this is what's happening to me. Her doctor says, Maria, I'm glad that you just told me. That's a very simple fix. We can just switch your medications. She's like, really? That's it? And the doc says, of course. So she switches her medication from an ACE inhibitor because she can't handle the side effect, right? To another type of medication. And guess what? Maria went and rocked her audition. That's right. She got a record deal from it. And I'm pretty sure you heard her song on the radio yesterday. Why? Because Maria got nominated for a Grammy. Go Maria. Wow. All because she just spoke up and just said, hey, I'm not able to handle this side effect. And then you realize, like, wow, this is not something you have to, go ahead and just have all the time. You can just switch to another medicine. There's so many different classes of medications out there for your blood pressure. So let's get it under control. All right. So let me know, did you like this info? If you did, hit the like button. I really appreciate it. And let me know what you took away from today's info. Let me know. Do you know anyone with high blood pressure, or do you have high blood pressure? Are you on medications? If so, if you know someone with it, share this info with them so that they can see. Don't keep all this great info for yourself. Share with someone you know will benefit from it. And please subscribe to our YouTube channel. Yes, subscribe to the YouTube channel. It's www.youtube.com/YourCaringDocs. Subscribe so you can get some great info. All right. I'm Dr. Tamara Beckford with Your Caring Docs. I look forward to seeing you guys next time.